Last week, we premiered a video announcing that we were changing the name of our YouTube channel from Living Well with Schizophrenia to Living Well After Schizophrenia. And this is a change and a decision that we did not come to lightly. It has been a hugely transformative experience going through the last 9-10 months of kind of reshaping my understanding of mental illness and also what is possible in terms of recovery from mental illness. I really, really appreciate all of the support and encouragement and excitement and well wishes that we've received in relation to that name change and that kind of proclamation of this experience that I've gone through over the last 9 or 10 months. But likewise, I also really, really appreciate people who have brought forward perhaps more critical feedback or hesitations or skepticism or worries or concern around it too. I think that I am moving further into understanding that this is a really, really big conversation. I think that is going to be had within patient groups, within the medical system, within society at large, about this kind of shift in understanding of things like mental illness that I kind of talked about having gone through myself over the last 9-10 months. I said in our announcement video that I've really been concerned throughout this of wanting to make sure that no one is feeling left behind, in a sense, by this shift in the way I'm approaching my mental illness and our content and whatnot. And yeah, so in an effort, I think, to try to bridge that divide a little bit, I really do want to lean into conversations talking about things that people may be struggling with concepts or ideas or stuff that I'm bringing up, and really get into what I hope can be meaningful dialogue about it. I've talked in other recent videos about how polarization is kind of a rampant issue in our society, talking about difficult or big topics. And I think that this could be one that could really, really easily happen with, whereby we just divide into camps of yes, metabolic therapies or no, conventional forms of treatment for mental illness. And I can see how already in comments and whatnot, those are really starting to kind of villainize the other side a lot. And that is something that I want to work really hard to avoid and really try to, I think, recenter ourselves in terms of being a group of people who care very deeply about what I think most, if not all, of our ultimate goal of is to figure out how to live well while navigating challenges in life like schizophrenia spectrum illnesses, and trying to figure out how to reclaim a sense of control or autonomy over our lives, or maybe just a feeling of contentment with our lives, even in the face of an illness, and figuring out what that means for each of us in terms of how to thrive within our own lives. And so in this video, I'm wanting to address and talk about and get into deeper conversations about a lot of the criticisms or concerns that have been brought forward as a result of this name change and what that means for the conversation we're going to be continuing to have around mental health and mental illness on this channel. So maybe the most prominent concern that we've heard has been the idea of people feeling really upset that I'm suggesting that I've cured my schizoaffective disorder. And so maybe it's important to just start off by clarifying I have never said that I've cured my schizoaffective disorder or even suggested that metabolic therapies are a cure for mental illness. When I decided to align myself with this idea of living well after schizophrenia, it doesn't mean that I think that my schizoaffective disorder is just completely gone. What I'm understanding, or my understanding of this, is that I am using metabolic therapies as an intervention to get at the underlying reasons of why I was struggling with symptoms of schizoaffective disorder, and it's treating and managing that. It doesn't mean that I don't have schizophrenia or schizoaffective disorder anymore, but it does mean that I am treating the underlying issue through metabolic therapies, which is actually something that, medication never could really get at. And subsequently, that is eliminating my experience of symptoms of schizophrenia or schizoaffective disorder. And so that is kind of where I'm coming from in terms of this feeling of living well after schizophrenia, because these symptoms are not a part of my day-to-day reality anymore. They're just not something I experience anymore as a result of using metabolic therapies to get at the underlying reasons why I was experiencing those symptoms in the first place. And I understand, or I guess hypothesize, because I'm not really willing to test this hypothesis just yet, that if I stop using metabolic therapies and medical ketogenic intervention, that I probably will have a return of symptoms, because that mechanism or that intervention that is treating the root issue of mitochondrial or cellular dysfunction is removed. And so I think people are having a little bit of a hard time with that too, where, if I'm using this intervention that is controlling, or I think hopefully healing as well, but also just controlling my experience of symptoms, that I can't really say that I'm living after schizophrenia or that it's cured or whatever. And again, I am not saying it's cured, but my experience of my illness and my quality of life has changed and improved so incredibly drastically that it seems a little bit silly or irrelevant to get hung up on the fact that I have to do these lifestyle or dietary changes to keep up with that. I think it's also worth acknowledging that it is a challenge keeping up with this dietary intervention and making all these lifestyle changes that are culminating in the metabolic therapies that I'm using to manage my illness. And I understand that that can feel big and daunting and can kind of lead people into this thinking of, well, if I have to be giving up so many things and doing all these things and being so strict to control this illness, is that really freedom? Or is that really an effective, again, cure? But I said this the other day when describing it, that yes, it is challenging day in and day out, following these kind of more regimented ways of living. But the experience I've gone through over these 9 months of the, again, profound way that my experience of my illness and my life has changed really makes it the easiest decision I make every day. And I guess just the difference in how I feel on the ketogenic diet as compared to the standard American diet or what I was eating before just makes it really clear that what I was doing before was not serving me well from a health perspective. And I think maybe if you think about it in terms of someone with celiac disease, you wouldn't judge them or think it was woo-woo for them to cut out gluten from their diet. Understanding that, I likely will never go back to eating the way of the standard American diet. And honestly, I don't know if the standard American diet really serves anyone well, health-wise. There's a reason why we're seeing kind of an epidemic of obesity and chronic disease. And I would venture to guess it has a lot to do with our nutrition and lifestyle factors. But I think a lot of people also have been worried about the idea of having to follow this really regimented routine and diet for the rest of their life. And I'm not quite sure yet how exactly I'm going to navigate this, but speaking to metabolic psychiatrists, my understanding is that it doesn't have to be a lifetime intervention. There should hopefully be enough healing that can happen over a couple, maybe a few years, that you can start to kind of loosen up a little bit in terms of maybe moving more toward what you might conceive of as a paleo diet, where it is still whole foods and no refined carbs or sugars or anything, but you can include other types of kind of whole foods carbohydrates that are better for your body to use, such as fruits or other kinds of veggies or whatnot. But honestly, even if I did have to follow the ketogenic diet for the rest of my life, I absolutely would, just based on the benefits that I receive and the completely different experience of my illness that I'm experiencing following it and because of it. And now this said about being able to kind of loosen the grip on this sort of thing after a few years, I do think it's important to clarify that I don't think anyone should expect to follow medical ketogenic diet for a set amount of time, 2 weeks, 3 months, a year, even 2 years, and expect to be able to just go back to their regular lifestyle choices or ways of living or whatnot and expect to just not deal with their illness anymore. I do think that a reality of this as an intervention is kind of a commitment to taking care of yourself in various facets of living that will ultimately be able to continue to get at the underlying issues of why you were experiencing symptoms to begin with. And kind of along those lines of understanding this as a medical intervention that you need to be kind of committed to is another bit of feedback that we've received from a small amount of people that they have tried following ketogenic therapy, but it didn't work for them. And I empathize with the frustration that comes with that. And just a reminder that I actually tried what I thought was medical keto back in 2020, and it didn't work for me then either. I didn't know at that time what I didn't know about kind of what it takes to use it as a medical intervention. And I didn't know a lot of things that came up as problems. I didn't know how to address them. I didn't know why they were happening. And so what was really, really instrumental for me in terms of being able to troubleshoot things as they came up or to tailor the experience for what my brain and body needed was having a keto coach who was really knowledgeable in using metabolic therapies for mental illness and being able to kind of guide that process and also liaise with the rest of my care team. People have come to me and said, I tried keto for 6 months and it didn't work. And in the same sentence have shared that they didn't do things like track their ketones at all, or they didn't measure their food or, count macros or stuff like that. And maybe for ease and accessibility's sake, I wish you could do this as a medical intervention without having to do those things. But it is kind of just a reality that you have to, at least in the beginning, until you get a good grip of how to implement it as a medical intervention and how to kind of tailor things and make it so that it is the most beneficial for you. It is also really, really important that you take on this medical intervention with the support of your care team. And this can be kind of tricky because there aren't a lot of medical professionals who know a lot or are trained in metabolic therapies or metabolic psychiatry. And so there does need to be a degree of teamwork involved in that. And I would really recommend that together with your care team, you check out resources like Metabolic Mind. They actually have a whole document that is kind of a guide for how to talk with your care team or your doctor about metabolic psychiatry or using metabolic therapy as an intervention for mental illness. And then you can also direct your care team to check out their list of emerging and ongoing research around metabolic therapies too. And now, when I mention working with a keto coach, that also kind of brings me to another big criticism or concern that people have brought forward about this feeling really inaccessible, whereby most people don't really have the budget to hire or use a keto coach to support them through this process. I am really aware that I had a tremendous amount of privilege moving through this exercise or experience of using metabolic therapies to treat my mental illness. It has basically been my full-time job over the last 9-10 months to dedicate myself to following the diet, to exercising, to focusing on my sleep, to getting all the different kinds of tracking devices and stuff to share with you the results. And I understand that that is not really an accurate portrayal of what is accessible or possible for the average person trying to use these metabolic therapies to treat their mental illness. That is really going to be a focus over the next year or so of trying to figure out how we can make it more accessible for the average person who wants to try it as well, and figuring out ways to do it on a tighter budget or with less time to dedicate and still hopefully see good results. Metabolic Mind posted an interview with a researcher. I will maybe post a link to this interview with a researcher who did a study using the ketogenic diet to treat mental illness in a neighborhood in the Bronx, New York, in a neighborhood that was deemed lower socioeconomic status. And I think all, if not the majority of people who were going through this trial were on food stamps and still were able to eat a ketogenic diet. And so I really want to explore that more. How can we make it accessible for anyone, regardless of financial means? But another thing to maybe think about in terms of why it was important to show this process and to show how it worked for me, even if it was coming from a very privileged perspective, is that I hope that it can showcase what is possible and maybe encourage not just individuals, because I don't think that the onus should just be on individuals to figure out how to access this and how to make it work. I think that showing more evidence of this working for people should hopefully push our medical system, our society at large, into a direction that prioritizes making interventions like this accessible for everyone. And so, no, it is not always the easiest as it currently stands for anyone to commit themselves fully or dive into these metabolic therapies as a means of managing their mental illness. But I hope that talking about it more and showing more how effective it can be can lead to broader societal change in terms of how we approach health and well-being. Another concern that people have brought forward is concern around maybe the finality that comes with changing the name to Living Well After Schizophrenia, and being concerned about what's going to happen if I do experience symptoms again down the line. And that's a fair fear or concern, and one that I've thought a little bit about too. And I think I've kind of landed on, I'm okay with using medication again if that's what I need at the time. And I think maybe this is again getting into how this can become kind of unnecessarily polarized, whereby it doesn't need to be this narrative of either metabolic therapies or medication, and they can't work cohesively together. I know people who are using metabolic therapies effectively, who are still taking psychiatric medication, and they found what works for them in order to feel their best and to thrive. And I don't think that if I needed medication down the line again, that it would even mean that metabolic therapies were a failure. In the time that I've been using them, they've greatly, greatly improved my quality of life. And so, yeah, I'm happy with that. And if I do need to use additional means of managing symptoms down the line, whether that's medication or whatever it may be, that's okay. I think, though, that I'm kind of understanding maybe the use of medication for me personally as maybe hopefully being able to be more of an acute situation as needed, rather than a kind of just a long-term thing thrown at my symptoms. Because I think that that is what I've really been struggling with, is kind of the more debilitating long-term effects of long-term use of these psychiatric medications. And based on my experience of using this intervention of metabolic therapies over the last 9-10 months, I do think that it would be more of a nuanced process of getting to a place where I decide again to take medication. I know from experience that there are a lot of things to consider in terms of tweaks or adjustments I could make in terms of the metabolic therapies I'm utilizing before I would maybe get to a point considering medication. But I think, yeah, people have this idea that I've been working to get off my medication, and that's just my complete goal, that I don't want anything to do with medication. I want to be off medication. And that's kind of what I'm trying to clarify. And maybe along those same lines, it's important to maybe also clarify that I am not anti-psychiatry. I've talked a little bit about this, about how, unfortunately, from my perspective, the really big focus in psychiatry is on psychiatric medications and using those to manage symptoms. And I have benefited from that in the past. Medications have been very, very helpful to me in terms of getting myself out of psychotic episodes that were very distressing and debilitating. The reality is, though, that this way of managing symptoms, kind of masking symptoms, comes along with a lot of side effects, not only in terms of extra symptoms that you experience, but kind of negative effects on your health long term. And so it seems to me kind of obvious or intuitive that psychiatry should ultimately have a goal of having people on the lowest dose possible of these medications while being able to manage their illness well and live life in a way that feels good for them. And so using metabolic therapies has allowed me to safely and effectively reduce the amount of psychiatric medication that I'm on, to the point where I actually am currently not on any psychiatric medication anymore. And not only am I not experiencing any symptoms of my schizoaffective disorder, but I'm also feeling just a lot better and more present, not being bogged down by the side effects that I really struggled with for so long. And again, this is going to look different from person to person. Maybe I'm an anomaly that I was able to get off of my psychiatric medication 9 months into using metabolic therapies. Honestly, from hearing from other people, it hasn't been that quick of a process for other people, and that's okay. Again, I really just want to bring our attention back to the goal of allowing individuals to thrive, whatever that entails in terms of ways of managing their illness. I really think that the ultimate goal here of psychiatry and of patients should be figuring out how to get to a place that feels the best for them and allows thriving. There have been a lot of people saying that changing the name of the channel from Living Well with Schizophrenia to Living Well After Schizophrenia feels too soon and reckless in a way. And to a degree, I think that maybe is kind of a valid feeling that, yeah, it's a big change to conclusively kind of make the statement that I am living after schizophrenia. But at the same time, I don't know if it's really possible to pick a definitive time where you are able to come to that conclusion. When I started to share that I felt like my illness was being put into remission at about 3 months into this project, there were people who replied back, "There's no way you can know that until 6 months in." And then now, 9 months in, when I'm saying I don't deal with these symptoms anymore, people are kind of coming and saying, well, there's no way that you can know that until at least 1 year in. And it kind of feels like this really arbitrary seeming amount of time that each person seems to come up with on their own is ever shifting. And yeah, it just feels a little bit difficult to navigate that. I've also heard from a lot of people that they just don't watch our new content anymore that is more focused on keto and metabolic therapies. And that's fair. You don't have to watch content that I put out. But it also makes a little bit of sense then why, if you haven't been following this experience and this journey over the last 9-10 months, that it probably would feel quite jarring to all of a sudden be met with this almost philosophical shift to living well after schizophrenia. And yeah, I've been thinking a lot about, well, how do we bridge that divide? How do we, kind of talk more effectively about these branching philosophical ways of looking at mental illness? And the criticism that this shift is reckless, or that I am saying that my illness is in remission from metabolic therapies, is irresponsible or dangerous. But it's worth maybe bringing this degree of criticism or skepticism to our current systems of practice. I don't think it's a big stretch to say that the current model of psychiatric care is also reckless to a degree. Polypharmacy is kind of a rampant issue within our mental health care system. There is often such a huge lack of informed consent about side effects of these medications that physicians are putting patients on. There's not really any talk about what withdrawal could look like or what the process of getting off of them could look like. There's issues around addiction. There's often a lack of symptom management even for a lot of people's experiences with these different meds. And there's just a general oversight of focusing on quality of life. My own interactions with my psychiatrist and my treating mental health care team have often been strictly focused on reducing hallucinations. And oftentimes what that meant was asking me if I was still experiencing hallucinations or positive symptoms or whatever that are kind of deemed socially unacceptable. And if I said yes, okay, let's up your dose of medication, with very little mind to what that meant in terms of the increased side effects that I would experience as well. And instead of looking at me as a whole person with goals and aspirations and a desire to live a good life, the focus was really often on just managing symptoms that are difficult. And again, I don't think that this is specifically the fault of my psychiatrist or of any medical professionals that I've come up with. I think it is just a flaw, I guess, in our current understanding of mental illness and how to treat it and what is even possible in terms of potential recovery. Shifting this understanding of what is possible in terms of recovery is really our ultimate goal with changing the name of the channel to Living Well After Schizophrenia. I've been told by psychiatrists that I should spend the rest of my life hospitalized. What if I had believed that? Where would I be? Or there's so many people who are told that they need to be on high doses of multiple medications that hamper their quality of life for the rest of their life. And maybe that doesn't need to be true. Maybe there is so much more in terms of what is possible for people who are experiencing these difficulties with their mental health to lead a better, higher quality of life. And so while again, I hear you that it does feel maybe a little bit soon to come to a conclusive spot of I don't deal with my illness anymore after 9-10 months. But at the same time, there also is an element of trying to balance the urgency with which we need to get this message of hope and possibility of recovery out to as many people as possible. And I hear a lot of people that maybe they're not ready to try this or it's not feeling accessible at this point in time for whatever reason, and that's okay. But I hope that the message here that can be taken away is that there is hope, that recovery is possible. And when you're ready, there can be other options to explore. So that was a really long exploration of a lot of the feedbacks and concerns that have been brought forth. And I hope that we can continue to have these conversations. Something, though, that I haven't really even gotten into yet on this video that I think may actually perhaps be the biggest part of the conversation that we kind of need to have as a collective going forward is the idea of how, for many people, myself included, perhaps especially me, mental illness often gets really, really intertwined with sense of identity. I created this YouTube channel around my experience of navigating schizoaffective disorder and of acceptance around living with the illness and what it means for my life. And inevitably, that enmeshes my identity with my experience of this illness. And so it kind of makes sense then that when something comes along or is proposed that challenges or threatens the existence of that piece of what has become our identity, in this case, the existence of a mental illness or the struggle of a mental illness, that can feel really difficult or even threatening, even if it is a good thing in terms of alleviating suffering. If it is a challenge of an aspect that has become a part of our identity, absolutely, that's going to be a struggle to process and, accept or lean into. I really love the wave, I guess, we've seen of accepting neurodivergence as being just differences in the way our brain works. I like that. And I like the idea behind that. And I also liked that we started to lump mental illnesses into this idea of neurodivergence. And I think especially when we start to view an experience like this as just being a difference in the way our brain works that we could even celebrate, I think that then, that does become difficult when someone comes along and says, well, I could fix that, because it feels like then that they're trying to fix you and that there is something inherently wrong with you. And I get why that is upsetting. But I think the way I kind of wrap my head around this is my experience of schizoaffective disorder, for the most part, caused me distress. And it kind of debilitated me in various aspects of my life. And so understanding it less as needing to fix a part of me and more as trying to figure out how to improve or work on a challenge that I face and ultimately improve my quality of life kind of helps me anyway to reconceptualize it as making choices that ultimately improve my experience of my illness and my quality of life, rather than making choices that diminish a part of who I am. I do not in any way, shape, or form think that you are a lesser person if you struggle with a chronic illness like schizophrenia. And I don't think that there's anything to fix about you either. But that doesn't mean that we shouldn't be open to ways to improve our quality of life. And so I'm really empathetic, and I understand that when really nuanced and complicated things like challenging of identity and having to reconceptualize our understanding of ourselves and of the systems within which we operate and society at large, I understand that that triggers pretty intense emotional response or a desire to protect ourselves. And that's fair. Again, I talked about how proposing these kinds of shifts in thinking or ways of handling these kinds of issues or thinking about things like this can really create divisiveness and this polarization. And I've been receiving a bit of that from people who are kind of lashing out at me in terms of, there's some people who are saying that they hope I have a psychotic episode soon or a mood episode soon just to kind of prove that this is not working. And I think where I'm getting at with this is maybe asking everyone to maybe have a bit more of a respectful and constructive conversation about these big things that I think are really important for us to wade through and talk about as a mental health community, but also to validate the intensity of the potential emotional experience of facing these sorts of big changes. So thank you if you stuck around for that lengthy video and discussion. And thank you very much for anyone who has commented or given feedback, whether it's positive and supportive, whether it's more skeptical criticism or concerns. I really appreciate all of the dialogue that we're able to have around these kind of proposed changes or, different ways of maybe thinking about mental illness or what is possible in terms of recovery. And again, I am sharing my experience on this channel, but it has been incredible hearing from so many of you who are also experiencing the same benefits or similar benefits as what I'm experiencing using metabolic therapies. It kind of feels like something that is hard to put words to until you hear someone else describe what it's like. And reading your comments about how it's changed your life really feels to me like, yes, that is my experience too. And so thank you from the bottom of my heart for sharing that as well, because that makes it feel even more important to get this message out there to as many people as possible, so that as many people as possible have the option of trying this for themselves too. And again, the accessibility piece, whereby hopefully that sharing as many stories as possible and as much information about this as possible will also push broader systems to make it more accessible and more mainstream, commonplace offering of care for people too. So thank you so much for watching this video. I hope to continue having these conversations with you. And thanks so much again for being here. Wishing you and your loved ones good health. We'll see you in the next video. Bye.